like to start out by thanking our sponsors for our lunch today and all of our goodies that we have. We have Denise Klein from Milestones Ranch in Malibu, but she's the executive director of Milestones Ranch Malibu, and she's one of our sponsors, so please help me give Denise a hand.
Hi everyone, happy holidays, and thank you for coming out today, and thank you Josie for this fabulous event. She throws the best parties in the industry, so let's give her a big round of applause. You're amazing, you and Jim, your whole family, everybody. So, in regard to Milestones Ranch Malibu, we are a 12-bed licensed dual diagnosis treatment center, and I'll just keep this short and sweet. Basically, our goal is to truly get to the underlying issues when we're treating the complex patients that Louise will be talking about today, and I think that we do a really good job at that. We take their laptops and cell phones away, so I think that tells you that we're very serious about helping people, and we have a marvelous team, and if you want a tour or would like to talk more, please track me down, and would love to have you come out and see us. So thank you so much, and have a good day.
And there's an envelope at your seat that has the brochure for Milestone, so everybody should definitely take a look at that. And then we have Yvette from Sovereign Health. I'd like to thank Sovereign Health for co-sponsoring the event. Oh, there you are. Okay, here's Yvette.
Hi, first of all, I'd like to say thank you to each and every one of you for coming and joining us. We are doing a fundraising for Safe House, so I'm thinking that everyone knows about that. I do work with Sovereign Health. I am an outreach for Sovereign Health. We are a nationally accredited facility, or facilities, holding license to treat mental health, dual diagnosis, and dependencies. At Sovereign Health, we do a lot of testing when our clients come in because we want to see where the brain development has stopped within the addiction. We offer several different types of detoxing. So we do a brain mapping, we do a BNR NAD detox, which is putting natural enzymes back into the body through an IV. We do a subacute detox, and we also do a social model detox. We treat adolescents from the ages of 12 to 17 and a half, and adults, male and female. We're located in San Diego, we're located in Utah, we're here in Palm Springs, San Clemente, Culver City. We're all over. So if anyone would like to know more information about Sovereign Health, please take the time to speak to me, and I give you all the information that I know. Okay, thank you.
Thank you, Yvette, at Sovereign Health. And we have Seth from Millennium. There's Seth. Wonderful.
Not Trip Josie, the best of my ability. Still chilling. Thanks everybody for coming out. I love the sound of my own voice, but you probably love it a little bit less, so I'll try and do really brief. Take one. I'm with Millennium Health. We do medication monitoring and urine drug testing specifically for inpatient drug treatment programs, IOPs, PHPs, Dr. Stangers. Really? I'm not loud enough? It's the first time I've ever been told that I'm not loud enough in my entire life.
Ma'am, do you order iced tea?
So we do specialty monitoring. We test for things like bath salts and synthetic THC and so on and so forth. And we do that as rapidly as possible so that we can take the issue of compliance off the table and get to treatment, which is really why we're here. So if you have any questions, feel free to grab me and help me about urine drug testing or metabolism. Enjoy your lunch.
And I'd like to invite Chris from Safe House to come up and talk a little bit about our fundraiser, the recipients to our fundraiser. And he's going to explain how the donations work and all the wonderful things that they do at Safe House, all their services that they provide to the children and young adults.
Hello, so I'm going to be splitting the mic with my coworker Billy. For Safe House itself, we have two different programs itself, Safe House, and then we also have Harrison House. I'll explain a little about Safe House. Safe House, we work with adolescents between the ages of 11 to 17-year-olds. These are runaway youth itself that are off the streets, in crisis itself, and also that need substance abuse program. We have a substance abuse therapist on board on that program itself, and we also work with human trafficking victims. For Harrison House,
Hello, I'm Billy William. I'm a case manager at Harrison House. Harrison House, there's two programs there. There's a transitional living program for young adults 18 to 21, the age out of 22. And then there's also a independent living program for 18 to 24. We are here to provide services for homeless youth. Our program consists of weekly case management and therapy. The supportive independent living program is for, they also have all the opportunities of those in the transitional living program, but they are not as required. They're more, it's an option for them to take those.
I'd just like to thank everyone being out here and supporting Safe House and then Hurston House as well with your donations. There is also a form that for everyone that is donating items or something that we use for our program itself. So if you did donate something, let me know. That way I can give you a form. The forms are going to be available. You can fill it out, and then we keep these forms, and then you do get a receipt from our donation coordinator. That way, if you are donating something with taxes and all that, you know, we want to make sure that you get a receipt for that stuff. So if you do donate anything, do let me know, or anyone here with staff. And they do have the forms. There is a box outside that if you can put your donations, gift cards, anything. But thank you again for any of the donations and being here as well.
Thank you, Chris, for everything, and Billy, for everything that you guys do. I absolutely appreciate your services in the Valley, and I know how much they're used and needed, and they're near and dear to my heart, so I'm excited about having them be the recipients of our fundraiser this year. I will put these forms near the red box so that if somebody donates, then you can just pick up a form, and you can also put that in the red box for them. And I'm Josie Ramirez Herndon, and my husband Jim and I started ATS, and we are also hosting today's event. Addiction Therapeutic Services Intensive Outpatient Program here in Palm Springs. We're less than a block away, catty corner across the street. If anybody would like a tour, just let us know, and we'll have you tour after the luncheon or any time. Marcia will be happy to give tours as well. Or Sharon, we have our marketers. So what we do at ATS, I'm going to say a little bit and then I'll have Jim speak. We treat clients 18 and over, and we have clients at all ages. We have quite a few young adults, and we actually have 2 young women that are in the Harrison House, and it's been a wonderful experience to have Harrison House available for our young girls that are literally on their own. They're 18 years old, and we're able to provide services at ATS with whatever their insurance might cover, and Harrison House will help them stay, clean and sober without any fees, because there's no charges for anybody that goes into Harrison House or Safe House. So it's an absolutely wonderful program. So I want to thank you guys again for what you do. And we see the clients that come in every day and how motivated they are, and how happy they are at Harrison House. They have their own apartments. It's amazing. So I just want to thank you guys for that. We do accept insurance and private pay, and we're 3.5 hours a day, so we're independently owned intensive outpatient program 5 days a week. We have a family program and wonderful staff, therapist, and Jim, who does the medical assessments, and he keeps everybody medically safe while they're in our program. And I'm going to have him talk a little bit more about the clinical services.
Hi everybody, thank you for coming out. I want to thank all our sponsors who are buying your lunch. And the Buntinis, which I don't know what those things are, but I'm going to find out. They're supposed to be really good. We meet our clients where they're at. We get referrals in the Valley. We get referrals from some of the treatment centers, Desert Palms, and our clients come, and if they've completed a 3rd step, we encourage them to continue on in their step work. If they're not in a 12-step mode, we ask them to work on their spirituality, because we believe spirituality is a component of recovery. Treat mind, body, soul. If they're on meds, I encourage them to stay on their meds. If they are seeing a psychiatrist, I encourage them to keep seeing their psychiatrist. Recovery is a big deal. You look at, we look at trauma, we look at life skills. A lot of our clients haven't had, they haven't had good parents. So we get to, be their kind of adopted parents and give them some guidance on how to be a young man or a young woman. And also our older clients also get to pass on their wisdom. So it's a great place. I love our team. I love our therapist, Celine, our counselor, Jeanette, our techs. Who am I forgetting? John and Joseph doing spiritual lectures with us. We've got a good team. We've got a great team. I want to thank you all for coming out. I want to tell everybody happy holidays. I want to thank our sponsors again. We couldn't do this without you. And if you have any questions, I'll answer them. Yeah.
I wanted to make one announcement we almost forgot about is we opened up a men's structured sober living house 2 weeks ago. So we're very excited about that, and it's ATS structured living house for men at Hearthstone. So but it's our house and it's managed by Hearthstone, and they're only our clients and that are at that home, and it's a 6-bedroom, 6-bath, very respectful, beautiful home in Palm Desert. It's $950 a month, and that includes transportation to meetings and IOP, and a gym membership and transportation to the gym every day at 2 o'clock. So it's a really nice, beautiful home and great price. And then we sent, and I know Michelle just opened up a women's house that we're supporting and trying to send our women to. We're working on, and it's Cielo, and that's beautiful. So we have the continuum of care, although we have clients that are local and that have homes, and sometimes if they even have their home here in the Valley, it may not work well for them to go back home. They might try it for a little while and then decide to go to sober living. So it's been our commitment over the last several months to figure out a way to have a home specifically for our clients so that they're safe there and they can continue with the work that we do at ATS. So we're very excited about that. And if you guys want tours of that facility, we can also, arrange that at some point. So thank you all very much. And now, one more announcement, sorry. Okay, our next luncheon, you guys should have the save the date, is January 9th, and we have Dr. Jim Golden, who most of you might know from the Valley because he was a medical director at Betty Ford Center for quite some time. He's going to be our speaker, and now he's medical director at Milestones Ranch in Malibu. How exciting. Yeah, so Jim went back to the San Gabriel Valley where his home is, and his lecture will be Addiction, the Brain, and Practical Tools to Enhance Sustained Recovery. And that's coming from an addictionist. So it's going to be very exciting. And that'll be January 9th, so I look forward to seeing you guys there. I'm very excited to introduce our entertainment. Here she is. Our entertainer, Mary Lynn Bates. I've known Mary Lynn. I first met Mary Lynn back probably in around 2000 when I helped Hemet Valley open their facility. And we had a very large open house. And Mary Lynn was local, and somehow we met, and she was our entertainment back then. And people still talk about it. So I found Mary Lynn, and I was like, I cannot wait to have her entertain us now, 14 years. And she produced a CD and wrote all the songs. Yeah, 12 songs, 12 steps. There's a song for each step. I was so impressed with her CD, and I've been passing it out to clients for years, and they just love it. And she's going to play some Christmas songs and entertain us. So help me welcome Mary Lynn Bates.
Oh, you better watch out, better not cry, better not pout, I'm telling you why. Santa Claus is coming to town. There we go. Taking a list, he's checking it twice. He's gonna find out who's naughty or nice. Santa Claus is coming to town. now, and I wrote it when I was first getting sober. And each song is inspired by the 12 steps, and it takes you through a wonderful musical journey of the 12 steps. And it was wonderfully produced in LA by a guy named Ed Tree, and it's got all the productions on it, and it's gone all over the world. I've gotten emails from people in Japan and Australia, and we used to do music conventions and all kinds of therapies and opening up homes for recovery, and it was just amazing. It was an amazing ride, and I couldn't believe that, you know, a drunk from Temecula, California could have a message and help people all over the world with recovery. It's really pretty amazing what God can do. And in the meantime, my kids were growing up, and they needed to have a little bit more attention and had it being at home, so I was able to stay sober and raise my kids. And today, both of them are in college. One is on a full ride, Duke University, playing volleyball. And the other one is at the University of Montana to play soccer. And those are all gifts of the program, you know, because I'm the kind of drunk that grew up in LA, you know. I went away from home and I got lost on the path, like you've all heard. And sometimes you guys can get discouraged when you're working with people because it doesn't work. And I'm here to tell you that it does work. And don't ever give up on those people. Don't ever think that your job's not important, because it's so important what you guys do. And you help people so much. And we need you. We need all of you. And so this is the actual third song on the CD, and it's called Surrender. Because where would we all be without our higher power? When I look at a flower or gaze at the sea, I know there's a power greater than me. When I look at the stars and see the moon change and shade, I say thank you for your amazing grace. And
There's one right here.
my heart is filled with gratitude. Your love is what I need. I fall to my knees. Please show me what to do. I surrender to you. Pick me up every time I fall down.
Some broccoli, yeah.
I know. Oh, wait. You fill my mind with wisdom and you give me courage to do the things that
You're gonna have to excuse me.
Sure, no problem.
It's for you. This one is for you.
I surrender to you.
sorry, I didn't hear. I'm sorry, what? The melody in the beans? Yes.
Come on, clap your hands.
I'm hurrying.
Thank you guys so much for everything. If you guys want some CDs, they're outside. They're only $10. They make great gifts. Great way to listen to recovery. It's different than listening to a speaker tape. And I really appreciate all of your support, and I really appreciate everything that you guys do. So, Merry Christmas, Happy Holidays, and Happy New Year.
Okay, are we all ready? Going to be bringing up our distinguished presenter, international speaker. Dr. Louise Stanger earned a bachelor's degree in English literature from the University of Pittsburgh, master's in social work from San Diego State College, and doctorate in education leadership from the University of San Diego. Louise has over 30 years experience as a professor, researcher, and clinician. Today she serves as director of All About Interventions and as president of the Sidney D. Holland Foundation, and is president of the Sidney D. Holland Foundation. Louise is a Mint trainer of trainers and has had a distinguished academic career at San Diego State University and at the University of San Diego. An expert in sudden death, grief, and loss, Louise worked with the New York Fire Department Widows of 9/11. She is passionate about the work she does with families and remains committed to the exploration of integration of treatment strategies such as motivational interviewing, cognitive behavioral solution focused, family systems, and 12-step. Louise was recently honored by Foundation's Recovery Network Moments of Change Conference as the best speaker of the West Palm Beach Conference. Wow. With over 2,000 attendees. And believe me, this is the best conference, one of the best conferences in our field. Help me bring up and welcome Dr. Louise Stanger, a dear friend of mine.
Okay, so I'm not used to having a room this big, so I will run around. But first of all, oh golly gee, you better get him this coffee. First of all, thank you all for taking time out of your busy lives and careers. I know there are people here from many different walks of life, many different types of treatment providers, many business owners. So I really want to honor all of you, and I apologize if my back goes to you sometime, for taking time to come today. What I hope to do is, in fact, I think I need an intervention here because sometimes this room looks a little bit like a triple threat to me. So I can wander around. I'm used to running around, talking with all of you, but I assume that all of you know one another and that you had a chance to introduce yourselves to one another. If you haven't, that's part of the synergy of our profession, is you never know who you'll meet on the road, and you never know who that person you happen to meet today may help you tomorrow. So I want to honor you with that. I'm kind of, if you have questions or if you have answers, don't hesitate to stop me, because this is really a beginning dialogue and an inquiry. One thing you should know about an old professor, we can take one sentence, just one little sentence, and weave it around for an hour and a half. So hopefully this will entertain you, energize you, get you thinking, and get the conversation started. I probably have too much material is what I'm trying to tell you to cover it all today. So this will be, I hope, as Denise Klein says for Milestones, the beginning of a incredible conversation. You are the first people I am introducing the word triple threat to. I did have the opportunity to coin several years ago non-intentional emotional unavailability. And that means that we know that everybody loves everybody else and cares about them, but when we're in the midst of a disease or we have experienced a sudden death or we're in the midst of a trauma, sometimes we just can't be available in the same way we are to other people. And when I worked with the New York Fire Department, the widows of 9/11, and interviewed widows and widowers across the United States, I realized that they were non-intentionally emotionally unavailable to their loved ones, to people who cared. And today, I'm really trying to break through and coin a new word. And you'll tell me, because your feedback is really important, whether you like the word or not. So often in our profession, in our field, I keep hearing about, well, you know, we're primary substance abuse. Well, you know, we're primary mental health. We now do something called dual. And I work as an interventionist. I love it. I have never met just primary mental health, primary substance abuse, and walked down the street and said, oh, hi there, how are you? You're a dual, right? You're a dual, because there's no such thing. There is something that is, and triple threat. We're always doing something beyond. And I hope to articulate what I mean by that today, get the conversation going. But I need my clicker first. Okay, so let's see if I know how it goes. Oops. So I'm going to bypass this because all of you are getting to know each other, and if you haven't, I'm going to try and finish on time. So you have to figure out, is there anybody that had any burning question besides wanting to win the raffle? And was there anybody who wanted to have anything answered today? If so, please let us know. And I hope you think about what you want to get out of our time together. Obviously, you're going to get some CEUs. Aren't they delicious? Except those of you who are doctors, I want to thank you because I don't think they do CMEs. Or psychologists, I don't think they do that. So what I hope that in our time together we're able to do is we're going to take an ecological approach. How many in here are social workers? Okay, so what's an ecological approach, Denise?
It's looking at the whole, it's looking at the entire system.
You have to stand up. Oh, I call on people too. They don't like that. Okay? It's not all about me. Go ahead.
It's absolutely looking at the whole system.
You take a look at the whole system, and we talk about it from micro, meso, and macro. Micro means the individual. Hi, how are you? Meso means this table, and macro means our whole treatment community. It's really easy, and how we're going to make an intervention really depends about that. We're going to learn when we take a look at triple threats, how do we prioritize intervention strategies? Sometimes we just don't know which came first. Is it mental health? Is it substance abuse? Is it legal? Is it physical? We just don't know. And we've got to sort of feather through because we have to decide where we're going to intervene, how we're going to invite someone to change, and where we're going to start. And one of the other things we're going to do is we're going to identify therapeutic interventions. Now, I do not wish to insult anybody. There's not a treatment center in this country that doesn't talk about evidence-based modalities. I have to tell you, I had the privilege of being a Department of Ed and NIH AAA researcher for about $5 million worth of grants. There is not a treatment center in the country unless they're involved in a research study with a control group somewhere else that is really doing what we call evidence-based research. It's a misnomer. What does that mean now? It means that I've been trained in motivational interviewing, I've been trained in DBT. As an individual practitioner, I've been trained in solution focus because I really love that. I've been trained in 12-step. But what it means as a group or a treatment center, we use those operationally. But we're trying to, and the way Stanger interprets it, the way Milestones, the way Sovereign, the way all people interpret it, Betty Ford, that is the way it's used. But when you say you're evidence-based, you're using modalities that have had research behind them. You are not currently part of a research study. I guess it's just a little craw that I have to get out there because everybody says they're evidence-based, and the only evidence I know is that I'm really here, right? I'm here. I'm so excited to be in the desert today. So, I do know that, and I really thank Josie for taking the risk for inviting me. It's really an honor. So thank you, Josie. I don't know where she went. We're sharing salad today. So, one of the things we want to think about is understand that when one disorder is going off this way, another one may be going off that way. And I have an example a little bit later that one time we were doing an intervention on, and I changed the names to protect the innocent. I changed the sexes to protect the innocent. So I can't tell you actually case studies, but I can tell you really hypothetically case studies. So we had someone who was a woman who was actively manic in the midst of a shopping addiction. She would go and she bought $60,000 worth of, $60,000 could be in some place. If you went to Cabazon, it could be a couple purses, right? Prada purses. But she bought $60,000 worth of 350 or more trinkets from an antique center in good old Solana Beach. There was so much stuff she didn't know. At the same time, she was drinking at the rate of maybe 2 bottles of wine a day, or more. At the same time, she hated her husband. She wanted a divorce. And physically, she was going through menopause. Her family of origin was really, so while she was off running in one direction, certainly we would say she was, out buying. She was also drinking, and she was also pissed off at hell, at her family. So what are you going to do first? Where are you going to go with that? That's what I mean, that sometimes one disorder can be going in one direction, another can be going in another direction, okay? And that we're not even beginning to talk about the accountability team or the family that you work with, because that becomes really important. And so we talk about what we call triangulation of data, and I'll tell you what that means. That means that you're getting information about someone from a variety of different sources, and you do it individually. You don't do it collectively in a group setting, because I have found that when you talk to people individually first, before you bring them in a group, you can really learn, you paint a portrait. And I'm going to talk about the research methodology that I use, not that I really like. The other thing is, how do you pick the right treatment center? Here we are in a room with wonderful, fabulous treatment providers. But each one of these treatment providers is not all things to all people, right? You can't be all things to right people. So it's really important for people like me to know what you specialize in. And it's really important for you to know in Jim Collins, if no one's read Good to Great and is a business development person, I really invite you to read Jim Collins, Good to Great, what your flywheel is. What do you want to do? And it's okay that you don't say you do everything really well. For example, Milestones Ranch is one of the few places in the country I know that does well with TBIs, traumatic brain injury. And that's something that when we talk about the military population is really important to know, but it's also for motorcycle accidents or anything. If I know I have someone with a TBI that's also maybe duly diagnosed, this is a great place. If I have someone who has a TBI, I'm going to rule out a whole bunch of this. But you need to know the treatment centers, you need to know what they do well, how they really work with you. So I really can't say. And I think if you look on my website, I do have a thing like not all treatment. I write a lot. So if you haven't got my newsletter and you're interested, just send me an email. But not all treatment centers are alike. That doesn't make them good, bad, or indifferent. It just means that they're not good, bad, indifferent. For example, his house is here, and if you want a Christian spiritual track, that's a great place to go. It may not be a great place for someone else. Every treatment center has a jewel. Every treatment center is a jewel. It's knowing their jewel and honoring it. So, which came first, the chicken or the egg? And we've already talked a little bit this. Sometimes we get work, and I tend to team with the gentleman who wasn't here today, so we're not going to talk about him. His name is Jeff Merrick, and he happens to be a lawyer. Sometimes people come to us and they have legal problems, right? They just sort of got that DUI. They just sort of got picked up for impersonating a police officer while stealing candy from the grocery store. They just happen to have a staph infection this big because they were shooting up Dilantin and they were also smoking butter. The fact that they were 62 years old might surprise you, but nonetheless. So how do people come to us? Do they come to us first with substance abuse? Do they come with us first with legal problems? Do they come with us first because they're delusional and they think they're growing genitalia? Okay? I'm not making any of these up. They're all true. I think that when I work with someone, and I really encourage you, if your staffs aren't trained in this, if you're not trained in this, I do trainings. I'm not here to, you must know how to do a family map. Every time the first phone call I have with someone, and I haven't booked them, I haven't done it, I say I'm going to start drawing a picture. And I do a family map, a pretty cursory run, where I take a look generationally, not just at mental health or substance abuse. I look for divorce. I look for religiosity, extreme religiosity. I look at wealth. Has anyone lost things? I look for trauma. And trauma, I hate this big T, little t. Have you heard about big T and little t? Big trauma, little trauma. Well, I have that news for you. When you experience loss and you are frozen in that space, you don't know the difference between big T and little t. That's a concoction or imagination of somebody else. If you have experienced the sudden death of a child versus you lose your car keys versus you were shot up in the war, sometimes the difference isn't known. It's an issue of resiliency. But the importance of family mapping is, and I have done work where this whole mirror there, I love it, is a family map that I'll use with a family. They don't have to be fancy. They don't have to be computer driven. But it's really important to teach your staff, to work with that. Because oftentimes you work with the identified loved one in a treatment center. You work with someone who's identified as having a substance abuse disorder or a mental health disorder. They think they're the fault. They don't realize that they had 5 uncles that were that had a substance abuse disorder and went bankrupt because the whole family's been looking at them, or they had a cousin that committed suicide, or there was a family breakup, or it was cross-cultural. So it's really, really fun. I love to do them. If you want any interest in them, I think they're a must. And they're a great way to start. They were developed many years ago. No one owns the family map or the genogram. It was a tool that was developed, and it's fun. And if anybody's interested, happy to share that. Whoops, where to go? So what we're going to do is, if we're talking about co-occurring, we're going to do a family history with triangulation of data. If you're thinking about someone being, not having a substance use disorder, how long have they been substance free, right? If they haven't been substance free, or you have a good social history that indicates that they've had more episodes, it's a good thing to put in your back in your mind that maybe that's going on now, but maybe not. By obtaining a longitudinal history, which I will call a retrospective analysis, because I do what's called a rocking chair analysis, right? I talk to other people before. My job is to bring, or our job is to bring people to you. right? I'm not there providing the service, but I'm there to bring them to you. So I have to obtain what's called a longitudinal history. And in that biopsychosocial history, I want to try and take a look at what was Johnny like when he was a little boy. What was, was there a family history of depression? Was there a family history of anxiety? Did he have to go to all kinds of special ed? Or was there nothing, and we're talking about someone, was there a family history of schizophrenia? Because we know that substance-induced psychoses, how many of you have had people with substance-induced psychoses? Well, better yet, how many of you not had them, right? They look a lot like schizophrenia, and you can't tell until you're done, right? You're okay. So yeah.
It happens to us.
It happened to you. I know it happens all the time. So I do use a methodology that was based on the work, and I was taught in it. It's called portraiture, and what it is people will paint pictures of people with the words. The research methodology was developed by a wonderful, wonderful woman. Her name is Sarah Lawrence Lightfoot. She's an endowed chair at Harvard, and she's the only endowed chair at Harvard with her own name. That's not what makes her so special. She's an African-American woman, and if you like to read, I invite you to read some of her books. The Lives and Loss of Liberation, and where she first became famous was called The Good High School. She took a macro look at a high school. But what it does is it assumes that when I interview Mike, that Mike and I will talk with one another, but we become co-collaborators in the experience. And so I'm gaining a portrait. And when I work, I'm gaining portraits of an identified loved one that I have yet to meet outside of a photo. And so I need to find out what's really important. And so we also tend to use what we call a snowball sample. When you're doing an intervention, they'll say, well, these are the people I want you to talk to. And you go, well, hey, I wonder if there's anyone else who might know Terry, okay? And what I find out invariably is the person that they tell you never talk to, you don't need to talk to her. She's a sister-in-law, she's a friend. He only knew her cursory. The family knows everything. Well, most of the time, that outlier that they don't want you to talk to is really the person that helps you with the portrait. What happens, though, as the clinician or the interventionist or the collaborator, you become the holder of an entire portrait. And the reason you interview for triangulation of data separately is people will be so honest with you. They will tell you, and the questions that I asked are really pretty simple. They're probably no different than what you've heard. First, I asked everybody to tell me about you. And I will tell you in 7 seconds when you hear my voice over the phone or you meet me in person, you will decide whether you want to work with me or if you even trust me or if you even care. And that's my job, is to do that. And that, from there, the questions are pretty simple. Tell me something. I want to learn something about Mike. I want to learn something about you. But then I'm going to ask you, Randy's going to be our identified loved one today. He's an older adult. We like him very much. And I just met him. I have no idea. But, tell me, what's so special about Randy? What experiences have you had that are so special with him? What makes him special? And I'm going to jar your memory because you might have to go way far back because Randy's been doing no good, very bad, awful things that are really driving you crazy. And you really don't like Randy right now. And what is it that and we ask questions like, what has caused you pain in the last year to 6 months? Some people want to go back to when they're born. It's a long time to go, but we'll listen with them. And then, what are your hopes? So that's really the information that's gathered in a really thoughtful way, but it's really done through triangulation. When you talk about triple threat interventions, you know how everybody says, well, in an intervention, here's a table. Here's our group, right? We're all going to sit in a circle. I don't use letters, so you'll have to excuse me. There's no letter writing. I'll tell you, you speak from your heart because it's the art and science of movement. I need to get you to move. Often it doesn't work in a group meeting. The other thing is, it does not happen, interventions do not happen in 53 minutes. Sorry, it's not a TV show. I'm written up in a textbook that says interventions are not made for TV. I know that's controversial. They can go on for hours or even months, especially if we're talking about people that have more than one disorder going on at the time. I'm thinking of one person, they definitely had a mental health disorder, they definitely had a substance abuse disorder, they were living sort of in a travel 6 motel, they also had resource because dad forgot to give up the trust fund, and they were getting money every month, and they had so they had resource, they had legal, and they had also a hotel manager that had a daughter in recovery who thought he could save this person. So it took 4 months to get this person to treatment. And it wasn't for a lot. Sometimes we've had people that need to have legal consequences. There's another one that I might talk about, that one of her favorite occupations, and I don't mean to embarrass anyone over lunch, but she loved to smuggle heroin in her bodily part. Can you guess what bodily part? Into treatment centers. And she had trauma as a young girl. Her parents were divorced. She had the meanest stepmother I've ever met in my life. The stepmother said, I'm not going to go to any intervention. I need to go work out. It was pretty mean. She was pretty mean, no matter what I did. And when I said, could you help your husband? She said, no, I hate her. I only like my 2 sons. I mean, think about that. She ended up going to a treatment center. She liked it so much she walked out the window, like here, and left. She ended up going to jail. Into jail, she smuggled it once again. Not a smart place that you smuggle heroin in. She ended up staying in there. She needed an interstate transfer to get out. So because she couldn't stay here, so we had to work on getting her an interstate transfer. She went to somewhere, she managed to stay 4 months, and then dad broke her out. And the triple threat was the father, because he just could not hold the boundary. And that was someone that we worked with for about 2 years. They do require an active facilitator. You need to know what you're doing because there's a lot of moving parts. I personally, when I do them, I work with someone else. I think it's overly arrogant that someone will work by themselves as an interventionist. Again, that's probably very controversial for those people that do it. I like having a team. Not everybody likes me. I don't know why. Such a nice person. But I'm also a mandated reporter. And sometimes people don't like mandated reporters. The other thing is, who's to say that they don't fall in love with my partner, my teammate? I consider him an equal. I don't consider, and he's very charming. And we also represent 2 different things. One of us, he's in recovery from substance use, and I'm in recovery from an entire family of mental health, substance abuse, and my own disorders. So we represent a really good team, and I think it takes more than one person if you're going to go into situations where it's very volatile and you've got a lot of different people to manage. And so I think that it can involve law enforcement. It can involve medical facilities. I did have someone where I never met the person. I intervened by teaching the family, and the father was 88. He really wanted to save his 62-year-old daughter. To do a change agreement in the hospital. Where was she going to go? She had a staph infection this big. You really need me to come? And now she's got maybe about 140 days of treatment. You have to support family or accountability. Treatment centers, please. I don't know, a family program is not enough. I personally, again, Stanger bias number 1302.4, believe that I won't engage anymore unless people are willing to engage over time. Why? Because we put together an accountability team and we sort of have a concierge kind of service. But I believe that the accountability team, whether it be a business manager, whether it be a parent, whether it be a hairstylist, whatever it is, that they need an opportunity to meet together once a week via phone. You don't have, this is not all in person. and hold the line to support you guys with all the hard work you are doing. And also it makes the treatment center really, really happy because they don't have to put up with the endless phone calls. Right now we have someone who went through 7 treatment centers. He is in a treatment center for the first time. He had for a year. And his family does not have the consent form. I do, and he's finally made it past 6 months of sobriety. What a miracle. Because everybody got out of the way and everybody stopped micromanaging. That doesn't happen all the time, but it does. So I'm not going to go over what are personality disorders. All of you need to know, and if you don't, you need to take a training. But with personality disorders, so anybody like, Raquel Lerner has this great book, The Object of My Affection is Your Reflection. The Object of My Affection is my reflection of your reflection. I don't know. It's about narcissism. I just got it all wrong. But anyhow, I got it right. Thank you. So if you've got a narcissist that you're dealing with, so you know what a narcissist is, right? Narcissist is someone who says, I'm so glad you came, but this is all about me. Yeah, I'm so important. Who are you? What, do you have a name? So it's all about them. And you can tell them that. Well, with a narcissist, if you're going to be working with them, make sure you compliment them. I'm going to pick on Lori. You look so lovely today. I am so glad that you're here. Okay? I'm going to do nothing but compliment her. I might take her aside to talk with her and her family. And by the way, sometimes we have a lot of parents who are narcissists. Sometimes the person that you have in treatment is acting out family dysfunction. Please understand that. That's the way they learn to survive. And so have empathy for that. With someone who is a borderline, like I love, I'm a university professor, so when I'm teaching in a classroom, the way I know I have someone, and that borderline is really an overused word, although I do love Randy Kruger's workbook. Stop Walking on Eggshells. I give that to a lot of people. But if I'm in a classroom, if Joe just yelled something out right now, just yell, whatever, just make some noise. Okay, so you need more cupcakes, right? That's what you want right now? You want right now more cupcakes, and you don't really care what I'm talking about because you're really interested. You're not interested in borderline, are you? Right now, no. You're interested in, what are you interested in? Okay, okay, so thank you, Joe. So in a classroom, you'll be talking about cupcakes, and they'll be talking about borderlines, and they'll be very disruptive. So have you ever had anyone in your center milieu that's like that? And honestly, you have to confront them and invite them. Joe, I really want to honor you. I'm really, really happy that you're here today. But I need to invite you to leave because I want you to be able to listen to me. But if really the cupcakes are the most important thing, can you go in that other room and I'll see you afterwards. Now, sometimes in interventions you have to invite people to leave. And we'll have to confront them, but not in a loud screaming voice, but rather in a voice that's really calming. And one of the things you'll need to know with mental health, you don't raise your voice, you don't scream, but what you will do is focus in. And I will try and have eye contact with you. And I will try and enter your world. And if I think all these other people are distractions, I will invite them to leave because that's not a good idea. And I can't tell you, anybody who says that they are, I'm a clinician or I'm this, I'm that, I use motivational interviewing, I use CBT. If you don't use all of those, then you're not telling the truth. Because in the end, the one thing I know for sure is you are you. And when I interact with you, I'm going to be me. And I might put in my toolbox, I always give families homework assignments. They've got to research. They've got to do things. I might want to, on a scale of 1 to 10, how important is it for you to get your child help? And you might say, it's a 10. It's really important, but then you say, how confident are you? Because they're not willing to turn off this phone that they use to buy the drug dealer. You know, telephones. How many of you have clients where they say, I can't stop that phone. I can't turn that phone off. Why? That phone is dialing the drug dealer or is connecting them with the internet where they're watching the porn or anything. Do you really think that's one way you're going to track them? It's really sort of that. I like solution focused because I'm very pragmatic, and we're here today because we need a solution. The problem's gotten bigger than all of us, and sometimes we don't know what it is. And also, there. So this is one, I don't know which ones you'll like, but this is a case example with bipolar and other. So once upon a time, there was a woman who had 6 children who decided that she didn't want to be married. She was Catholic. She had big icons all over the house. She had a substance abuse problem, and she decided to enter into a kink relationship. Do you all know what kink means? Kink means like when you're on the internet. And my partner once made me wheezy on the kink page. And that means that you're in a relationship with a slave master. Any of you read 50 Shades of Grey or whatever it is? Okay, you know what a kink relationship is? Guys, where am I and where are you? Woo! We're spicing it up today in the middle of...
I was afraid to mention.
Oh, you're afraid to mention. So a kink relationship is where you're in a sadomasochistic relationship. You might be chained or whipped or, you know, what is it they do to cattle? You know, branded. Thank you, branded, prodded, but you're really not, you're in a relationship which I'm not saying is right or wrong, I'm just saying you've got 6 children and they're underage. And they may be in mania, right? Because hypersexuality might be mania. And your job is to try and join with the client in a non-threatening way where you might have to overemphasize and say, yeah, I understand your husband's a jerk. I really do understand the need for, you know, sexual exploration. But at the same time, one needs to think about the kids, you know, and child protective services. And you've got sex toys all over the house and big icons of statues like the Virgin Mary. So I'm really a little bit confused. How are we going to help you? And that means that this whole family, it's not just this person that's doing this, the whole family's doing it. So how can we help you sort of get out of this relationship you don't want with your husband and at the same time help you with your kids? So I got to instill hope. Very, very tricky when you're going to intervene that way. And if you don't know, you can't just go in there with 2 guns and say, hey, guess what? We're off to a trauma place or we're off to somewhere where there's sexual addiction. Not going to work. And when you're working with someone like that, how do you empathize? Because you think to yourself, what do I really think about kink relationships? Maybe I don't like them. Also, check your values out all the time. Check, how do I feel about this? You know, because we need to be honest. Not everything suits our pleasures. And that's how we need to do it. Obsessive compulsive disorder and borderline. Has anyone worked with anyone who has obsessive compulsive? So, once upon a time we had a family. And the family was like this. And see how you might want to work this. I love this family. Mother was as tall as Joe, and she was very talented lawyer, definitely borderline, definitely a rageaholic, and also a hoarder. And she had been to 20 therapists and said that she knew everything. Father, at one time, had been a very famous, let's say, psychologist, psychiatrist. Poor gentleman, he had suffered a stroke. And he was divorced from this woman. They had a very tenuous relationship. And for fun, what he liked to do the most, and again, I don't mean to offend anybody, he likes to say, you fucking motherfucker, 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 you fucking motherfucker, monkey. That's who I was. You are. The entire time. uncle was a successful, say, stockbroker who said, I only like to marry borderlines. And then brother, who was younger, can you imagine this for attachment? Poor thing, was developmentally delayed, and he had an IQ of 30. And young girl, the goal was to get her to a place that specialized in borderline, which meant that she had to have an interview, which meant she had to have a TB test. And how could we manage all these other people? So when we talk about inviting people to change, when you're doing an intervention, you're coming together for the common good to help one person, but you're really helping to move the whole family. So having another person, we were able to entertain the father, who was really like savant. He really was brilliant. He was able to tell us things we didn't know. And there was a liquor cabinet, and he said, you know, my wife, when I lived here, never gave me cognac. And we said, fine, you can have the cognac. I, in the meantime, had to take the young girl away from all the people. Oh, and I forgot, grandmother was a Holocaust survivor. Sorry. I knew there was one thing missing. But in this intervention, which took about several weeks, I have this thing of Milano. So you have all these beautiful little things right here. Can you imagine, and this house had a lot of mess because there were hoarders. Can you imagine for 3 days, yeah, I'm going to get this back to you. There was on a little table was a rumpled Milano cookie bag with about 2 specks of crumbs in this bag. And no one would move it, it was a symbol of the disorder. But it was really bothering me because I'm going like, are they gonna, can we move this? Because if we can't move this, I'm really in trouble. Somehow or other, we were really, you have to be consistent. You have to not give up. Someone said to me earlier, they say no, and I go, Eskimos have 1,000 words for snow. We hear 1,000 words for no. You do 2 in treatment, and the only word I know is yes. But you have to believe in the yes. You must believe that yes is possible. The moment you doubt that the yes is possible, you're dead in the water. You need to indulge any obsessive-compulsive disorder. You are not going to change it in a moment. That family didn't just require the person to go to treatment. They also required someone who was able to come to their home, and they weren't really super wealthy, to work with someone who had an obsessive-compulsive disorder, help get rid of the stuff. And you have to do it like one by one. It's not so easy. You have to stick with the invitation, roll with the resistance, and be firm and say, we can do this, because you've got a lot of players, and especially you guys in treatment, you have a lot of outside players that don't, even though they say they want the person to be healthy, they're really not used to that person being healthy. And so you have to stay with it. Again, this is a triple threat. The only thing this particular case was straight mental health. But it was mental health and other. It was mental health and the trauma of generations of Holocaust survivors. It was trauma with being born into a family where the second child took all the attention. It was like not being able to function. It was living in total chaos. I don't know how any of you work with the military or have any special training in military. I happen to, because I was at San Diego State. I invite you. PTSD and TBIs are something that the military made famous. They're certainly not anything. How many of you work with post-traumatic stress or traumatic brain injury? Okay, great. If you don't, I think it's something that's worthwhile to, they're hidden disorders. You can't tell if I'm walking down the street and I hear a large boom, and all of a sudden I'm not here, or I experience a sudden death, or I hear something, you won't know that. For example, one of the interesting things, like when you work with the people from 9/11, and I worked a lot with the firemen and the firefighters, a lot of PTSD, but a lot of criticism about private people becoming public figures. And one of the things they didn't understand when you went into a home where a fireman had been deceased or anything, unlike some other cultures, the smell of fire is really important to a fireman's family. And so it wouldn't be unusual, because there were several generations of firefighters in the family, that the fire gear is out there in full force. So for someone like me, when I first entered into their world, and I want you to know you're entering into other people's world. Oh, I've never had an office, except my university office, because I believe that going out into the field is the best way to meet people. You need to do it safely, but I think the data is so rich. But when you go there, and the smell of fire is really important. Now, for someone else, if in a different culture and you were working with death and sudden loss, the idea of still having clothing out over time would be seen as highly suspect, maybe dysfunctional. And the smell. And so you need to understand the culture. PTSD, I don't know how many other people, when they talk about it, and today we have wonderful modalities, we have lots of somatic experiencing, we have brain scan, we have so much now that we didn't have. EDMR, TBIs are traumatic brain injuries. You can't tell if I fell on my head, right? I look pretty good, don't I? Well, don't answer that. But, you know, you wouldn't know if I had a traumatic brain injury or I fell off a motorcycle. As a young social worker, I started out in the Department of Orthopedics at University Hospital, which was in San Diego, which is now UCSD. And the first place they assigned me was the Department of Orthopedics. So one day someone would be riding a motorcycle, the next day they might have traumatic brain injury, they might be paraplegic, and the transformation. So I started out really as a social worker, taking a look first and saying, hey, what's wrong physically? Let's find out what's wrong physically before we go into psychiatric diagnoses. But this is great. So if you need this information, just let me know. You know, this is what TBIs, bicycles, assaults, struck by somebody, trafficking. 20% of traffic accidents cause TBIs. I don't have the stat right now that puts it up against a DUI. So that's there. You have to be upfront and honest when someone has trauma, no surprises. You need to understand what's called a two-min. A two-min is just really being able to be with you. You need to be able to educate people about these things. Honestly, we talk in a foreign language, right? We talk about, and you'll notice in my discussions, I never call anybody alcoholic, addict, borderline, whatever. I will say people experience a substance abuse disorder, people experience mental health disorder, people experience a physical disorder, they will experience legal consequences. Why? Because there is some research that indicates you can label yourself anything you want to, and if you choose to label yourself because sometimes you can use those as excuses, you can label yourself alcoholic, addict. That's not for me, because you are more than whatever assessment, whatever diagnosis you have. You're a human being. And if I only characterize you in that way, I have done you a great disservice. You are a person, you are a family, you are an accountability group that's experienced many different things. And far be it from me to put that label on you. You are free to do that. But as a professional, as a clinician, as an educator, as someone who teaches your families, your friends, your thing, I won't do that. If you do have someone who's a perpetrator, you do have to invite them to leave, because it could be way to that. And you don't let abuse become the focus of anybody. That's why if you're doing interventions, I mean, the way we do it is we'll interview everyone separately. We'll have a pre-meeting. We pretty much are in control, and people will speak from their heart. And we need to manage anger. This is not about anybody getting mad. And the same thing when you run your family groups. For people who are, how many of you are getting a lot of people that are psychotic, or you think are psychotic, or in psychosis? I mean, lately, because maybe we get complex cases, that's pretty much what I've been seeing lately, are people that we would say are delusional. They imagine there's something other than they are. They have a lot of paranoia. The FBI might be following them. They're going to be found out. And really, you have to think of what kind of pain are these people in to feel this way? And how are we going to explain to their families who are so scared, so held hostage by them because of these delusions that they're walking on eggshells? We know that, how many of you have clients that have done butter, B-U-D-D-E-R? If you don't, then you need to go find out about it. Butter is melted down marijuana, and if you have a predisposition to schizophrenia, that can do you in. It's really, methamphetamines, we see a lot of meth, alcohol, ecstasy, but how do we tell the difference between is it paranoia or is it not? My teammate had someone who was impersonating a police officer and running around trying to, so of course he got arrested. Now can you imagine how much law enforcement liked him? And can you imagine the art of, here's a guy, he's really delusional, he had substance-induced delusions, plus he had mental health disorders, helping work with the family, but also with the police department and the legal system to say, hey, let's not put him away, let's send him to treatment. I talked to you a little bit earlier about my wonderful young woman who likes to smuggle heroin in her vagina, and you know the tragedy is that she really needs a family. When you're working with these people, you do low stimulation because there's a lot of high stimulation going on. You have to be the person that remains calm in the face of everything. That means we might walk into a hotel room where everything in the hotel room is torn apart. The phone is taken out of the wall. There's bulbs and syringes, and there's broken Ben & Jerry ice cream in the sink, and there's dresses that look like you walked the night. There's other things, and we may have a father say to us, you know, I'm sure you've seen worse. And you say, no, I haven't seen worse. This is pretty bad. This is about as bad as it gets. You may need to, and I really caution, if you're not a clinician, this is hard to do, is enter into the delusional system. Several years ago, I was working over here in the desert, and I will close up. I guess I'm running out of time, so I just want to wrap up. I'll do one more little thing, and then I'm going to stop. If you're interested in this is just the beginning of the dialogue. I got lots of things, but I was working over in the desert, and a wonderful family, and a young woman had mental health and had gone off to, I guess, see the Maharishi or something else like that, and everything, but she believed the television set was talking to her, and she was in communion and doing a yogi with the television set. Well, Benjamin Rush, does anyone know who Benjamin Rush is? Benjamin Rush was around the time of Benjamin Franklin. He was an MD. And when he talked about entering into the world of someone who is actively in a delusion, he said, go into it. And my partner at the time was Sean Fertel, and Sean was sitting on the floor, and he looked at me, and Michelle, stand up for a minute. And so, it's okay, you're looking at the TV set, but we're going to do yoga together. So, okay, I hear you. You're with the yogi right now? You're with the yogi right now, right? Okay, so I'm with the yogi too. Let's do that together. Come to me. Put your hands like this. Yeah, we'll be together. Let's go like this. Okay, I just really love doing that. We might have done that for a good half hour. We did what we call join in. I know that my teammate was sitting on the floor almost ready to roll over. He had never seen that before, but you needed to enter her world, so I said, okay, can we go now? And she said yes. And it was a mental health placement. So you can't, but to do that, thank you. To do that, you need to know what you're doing, and it involves a lot of commitment. So you never know what you're going to do or find out. And I think the idea of a triple threat is You don't know what you're going to engage in. You guys get the patient. We see the entire system, and so we want to partner with you because our information can be sort of invaluable to you to help you navigate that world. And that world sometimes is a different world. It's a different cultural world and everything. I don't have a chance to talk about failure to launch, but I want you all to know, those of you that think 17 to 30 or your failure to launch have never met 60-year-olds that don't know how to do a checkbook. So FTLs can know any age group. Professionals, we haven't talked about professionals. There's a whole other realm with them, whatever they are. And public figures. Some people are public figures and they get really shielded. We know a lot. These walls, I love these walls here. They're lined. Frank Sinatra, Marilyn Monroe, James Dean, Debbie Reynolds. There isn't a person not lining these walls that couldn't have a story or didn't have a triple threat. Right there. They require, with public figures, you require a different set of teamwork. You've got to have people that are on the payroll. And you really need to get them to be not worried that they're going to lose their jobs. I love older adults. This is a wonderful book, The Graying Elephant in the Living Room. I apologize. I am a graying person in the middle of the living room today. Okay? Don't put past the older adult. You know, people sometimes, when I did work on widows and widowers in the United States, people would put them off. And so often, if you've experienced the loss, the first thing the doctor will do is give you a Valium, give you a sleeping pill. But do any of you ever go to CVS or Rite Aid? Do any of you go to a grocery store? All right, these are trick questions. This week, when you go to the grocery store, the checkout, I want you to look at the checkout line, and I want you to see how many lonely older adults there are. And I want you to think about the macro, because the oldest person that's ever hired me to intervene on a daughter was 92. I currently have an 88-year-old father who actually sexually traumatized his one daughter, and now he's making amends. But you're never too old to be intervened on. And boomers like myself, you really need to take a look and think about what type of treatment centers you're going to have. How can you accommodate that special population? Physical limitations. Those of you, I teach a course, and I think Betty Ford would be happy about this. The book that I just used, one of the books I have people read right now, is the story of Marlee Matten. Marlee Matten is deaf, very famous, and Betty Ford saved her life. I also use the book Still Alice for aging, which is just going to become a movie. But people with physical limitations, do we ever think about what treatment center are you going to put in someone who's paraplegic? Huh? Where are you going to send someone who's deaf? Where will they have interpreters? Where will you go if someone has some type of physical disability? These are really important questions, and they become part of your treatment plan. Lastly, look around the room and give each other hugs. Please. It takes a village, and you're the village. So take some time and applaud yourselves. There's a lot of resources. Thank you. I have lots of resources. And I'm sorry I went over. So thank you. If you have questions, come see me or write me. I gave you all my email. If Denise can tell you about my newsletter, so she'll know you about that. But bigger.
Thank you so much. No, we didn't want you to stop. We'll invite you back again.
Yeah, well, it's a great dialogue.
Okay, now we're going to do our raffle and kind of change gears a little bit. Okay. While you're completing your CEU paperwork, and I am going to invite the sponsors to come up and help me, Denise and Yvette. I don't want to be the only one up here. Where's Seth?
What are you gonna give away?
Oh, there you are, Seth.
This one?
Okay, yes, that's from Sovereign Health.
There you go.
It's a gift basket. So you guys, you want to pick the name?
Yummy.
Wait, hold on.
Or would you like me to
Pick the card.
Go ahead. Somebody pick a card.
Go straight to the bottom. Terry.
Oh, Dr. Terry Cortland, and she is not here. And you do have to be present tomorrow.
Yeah, no gifts.
Present?
Yeah. Is that Charity Gray?
Yes.
The Charities Sober Living. Wow, I like that. Charity Sober Living, Charity Gray. That's amazing. Thank you. What a great name. Okay, so and then we have Mary Lynn, and she's donating 2 of her CDs, so we'll draw 2 names for that.
Pack it away.
Is that Matt Mazureka? Is he here?
Yeah, that's Matt.
Where's Matt?
Oh, he's gone. He was in the back.
I didn't even see him. Okay.
Oh, another one.
Well, you have to be present to win. Nice. Oh, who else left?
That's Liz Tiger.
Terry Gatewood. Is Terry still here?
He's gone.
Oh, goodness. All our therapists. I'm just kidding. Oh no, Carol Teitelbaum. Shall we go ahead and give to her husband? Yes. Yay. Robert Teitelbaum's the winner. Woo. And remember, you guys, there's flyers out there for the Creative Change conferences. And our February one is a women's conference, and I'm actually going to be on the panel with the best.
There you go.
Okay, Chris Mendez from Safe House.
Yay,
Congratulations, got the CD. Wonderful.
Anything else?
Yes, now, next Wednesday, the 10th, is his house and New Creations Christmas party. And finally, all year we've been selling. Tommy, do you want to come up and talk a little bit? Tom, you can pull the drawing, Tommy. We've been talking about they're giving away a Harley, and it's going to their foundation for scholarship beds and education. They have a vocational education program. So these tickets are $10 each, and I still have 28 to sell. So if anybody would like one, goes to charity, and I promised Glenn I'd sell them. So I'm buying some of these from ATS, but since I'm part of the team at his house, I can't participate. So I'm going to give them away as a raffle. So I'm making sure I'm following all the rules. All right, Tommy, go ahead, pick our winners. And we will enter your name, and you do not have to be present to win, but we would love for you to be there. Okay. Jonathan. Okay, you don't have to be present to win the Harley, but you have to be present to win the tickets. Okay, go ahead, pick it up.
Tribal, was it Olga?
Olga? No, Olga left. We're busting. Yeah, everybody that's left, we're picking their name.
Betty Ford.
Michaela? Is that Michaela Sands?
Michaela Sands?
Yes, Michaela. Did she leave? Oh, she's gone. Okay. Well. No.
Jeffrey Bronson?
No, Jeff's here. Yay, we have a winner. Yay, finally. And you know what? You never know. You might win the Harley. That's pretty cool. Yeah, give Tommy the stuff and he's going to put it in that big spinner
What do
thing.
you got? Another one?
Okay, we have more.
State of California, Catherine Ball.
Katrina Ball.
Hard to read in the dark up here.
Okay, Katrina, good luck with the Harley. And there are other cash prizes as well, I
Yeah,
believe.
there'll be other
There's going to
stuff
be a
given
lot of,
away.
yeah, so. But the Harley is the big prize.
Terry Courtland?
Okay, oh, she put 2 cards in. Wow, she put 2 cards in, she's fine. No, I'm kidding, we probably put it back. I know Terry wouldn't do that.
Put it back. Blue Tiger Recovery.
Oh, did you put them all back?
He's not here.
There's no name on it.
He's gone too. I think you put to him. No. He always wins at our thing. Yeah. I'm just kidding.
John McAndrew from Sensible Spirituality.
Oh, John McAndrews, yay. I could see you on the Harley, John. Yeah.
One more.
And Tommy said if somebody wins a Harley and they don't want it, he'll buy it from them. I remember hearing him say that. You just have to go out to the parking lot.
Above it all.
Above it all? No, all about interventions. It has to be Louise, yeah? I can't see.
Louise Stanger.
Yep, Louise, you're the only one here. Yeah, you want a ticket for the Harley. Yes, that's it. And if anybody... Yeah, see, and Ed is going to be our presenter that day. It's going to be amazing. And he's talking... Yes. And he's talking about the history of addiction, research that he's done, because he's been also in our field doing interventions for over 30 years. So the flyers are at the table for that, and again, I have more tickets, and thank you guys, everybody, the sponsors, Denise coming from Malibu, and Seth. Everybody have a beautiful, beautiful holiday season. Thank you. And Louise, we love you. Oh, yeah.
I appreciate it.